Hey, what's up, guys? This is Larry. So I was working on some cardiac content this morning, and I got to thinking, if I ask most people and I say, tell me the difference between a heart attack and cardiac arrest out on the street, they might say, I don't know. They're the same thing, I guess. I don't know. So there's a lot of people that can answer that question, but there's a lot of people that also can't. So I thought before I put out my other content that's going to be talking about these things, a simple explanation between the two might be nice for people going into it. That way they know it. So if we talk about the term heart attack, can a heart attack lead to a cardiac arrest? They can, but they're not the same thing. So when we talk about a heart attack, you look at this model heart here. Look at all these vessels that go across the heart. You've got the muscle striations underneath. It goes around back. And so when we talk about heart attack, if any of these vessels get occluded with plaque or a blood clot, that's going to directly affect how much blood the heart's getting. And what does the heart need? It needs oxygenated blood. It needs to be able to feed on that oxygenated blood so it can perform like we want it to. It's just like anything else. If I didn't eat, which I could go without eating for a long time, obviously, after a while, I'm not going to be able to perform and I'm not going to be able to do the things I need to do to survive. The heart is no different. It needs that oxygenated blood. So if we take and we block off a piece of this with plaque or a blood clot, eventually whatever area that is downstream from that is going to suffer. And that's where we're going to see that muscle tissue get damaged or possibly even die, depending on how severe it is. And it's also going to depend on how severe the symptoms are. If this is in a little bitty vessel, they're not going to be as severe as something that's way up top that gets fed by this big caliber vessel. Either way, when we talk about heart attack, we're talking about a part of the heart that is not getting blood flow and is being damaged. And that's where we're going to get those associated signs and symptoms. The chest pain, the jaw pain, the radiating arm pain, shortness of breath. These are all coming from the blockages here. So now how does that vice versa reflect on cardiac arrest? Well, cardiac arrest, think about, is when the heart stops or it goes into a lethal rhythm. So can a heart attack progress to a cardiac arrest? Most certainly it can, but you need to know there's a difference in the two. Cardiac arrest means that the heart is no longer functioning or beating as it should. So therefore, these are people that are going to need CPR immediately and all those progressive treatments that follow. So I just want you to understand, heart attack, yes, there's damage. Yes, there's things that need to be done. It's not the same thing as a cardiac arrest where the heart stops or it's in a rhythm that is not life-sustaining. There are two major differences, but they get interchanged a lot. So I hope this helps you in your path forward, and this way you can educate your families and your coworkers, and hopefully you have a better understanding as well. Now we're going to get into some more in-depth things on our next cardiac presentation, so stay tuned. Let's get to it.